it's Chris with Rowe Dental Laboratory, and today I want to highlight this little book we've been working on for a while to make your lives way easier when it comes to full arch restorations and how to get them done. This is the Ultimate Restorative Protocol Guide. Now, in this guide, it has all the different workflows, analog and digital, as to how to get to your prototype or your printed try-in and then your final fixed prosthesis. And then it has the different scenarios. So as the patient, how do they present when they come into your office? Now, we've put together, there are 4 patient scenarios in the full arch world as to how they can walk through your doors. And just in the first page here, we have, first couple pages, we have them listed here. It's the patient walks in with just implants placed, and there's healing caps on the implants. They could come in with implants and multi-unit abutments seated already with healing caps, or they could walk through your doors with implants and the fixed prosthesis is their temporary, and you have to get them into their prototype and then final. And then the last scenario is an overdenture that you want to convert to a fixed. Now, there's challenges with all these, and we're going to kind of go through some of those challenges. All right, so let's talk about this scenario. This is going to be the implants without multi-unit abutment seated. So they walk into their office, implants are placed, either cover screws are on or there's healing caps on the implants. The challenge with this is we need to figure out the ideal multi-unit abutments to use to get you the ideal screw access holes so you have a nice prosthesis. How do you figure out those multi-unit abutments, the indexing of them, and have the right angulation? So there's 0, 17, and 30 degree angulations for your multi-unit abutments. Depending on your implant system, there may be a couple more, but 0, 17, and 30 are the standard ones. Now, another challenge, and of course we're going to help you out with that, and that's listed in this book. The other challenge is going to be establishing vertical and then establishing passivity of each of the implants. So we're going to need impressions for that, and it can be a digital impression or an analog impression. Honestly, in this particular scenario, the analog impression is still the best route to go. And again, we have that listed here in this book. So that's one of the scenarios that can walk into your office, and we got you covered. In this scenario, we have the patient walking in your office, implants are placed, and the multi-unit abutments are already seated, which is nice. Makes your life a lot easier because now you don't have to figure out the ideal rotation and angulation of each of the multi-unit abutments is done for you. But the challenge with this is, of course, we need to establish vertical, and we have to establish passivity. We have to make sure that the prosthesis we're going to make for the try-in is going to be completely passive so there's no breakage. And again, how do you do that? It's all in this book, and there's, again, multiple workflows on how to do that. Ideally, for this particular scenario, yes, there's a ton of great digital technology out there, but an analog workflow to start off with is probably the best, most cost-effective route. And again, it's in the book, but we're looking at multi-unit abutment level impressions and then get that to the lab. If the patient is wearing a denture in this particular scenario, that's a good thing. You can do a digital workflow where you 360 scan that denture, or you can flash that denture, get it to the lab, and then from there, we're going to get you the next set of records, again, listed in the book. All right, in this scenario, the patient is walking into your office and they have a loaded prosthesis fixed on multi-unit abutments. Now, there are a few different great ways to get this done in the digital world, or you can do it in the analog world. The issue with this is how to get those records to the lab, because we need to establish, the correct vertical for the next prosthesis and passivity. So again, there's a digital workflow you can do with the patented iJig, again, listed in this book. There's an analog workflow where you can flask the existing prosthesis, put some analogs in stone. It requires some lab work, but then again, that gets you to a printed try-in and then ultimately a final. So the fixed prosthesis on multi-unit abutments, you're in pretty good shape here. Not much to worry about, but there's still a little bit of work you got to do. 2 to 3 appointments, typically maybe a fourth in there to get to your final, but you're a lot closer in this particular scenario. And again, we have all the different digital and analog workflows all listed out for you in this book. In this scenario, the patient is walking into your office. They have an overdenture and they want to get rid of this thing. They don't like the palate. They want to be able to taste their food and they don't want this thing moving around. So let's get them to a fixed prosthesis. Now, this is probably the longer of most of the scenarios as far as getting them into their final fixed prosthesis. There's analog workflows, there's digital workflows, all listed in here. Some of the challenges with this are we have to have a new prosthesis made to either be converted or there's other workflows as well, but you got to have another prosthesis made. We have to reestablish vertical, establish passivity. So that can be done, again, digital or analog workflows. Usually to establish passivity, we'll do a verification jig with that. And ideally, we have analog records for that. There's great digital workflows out there, but the most cost-effective to establish passivity is the analog record at multi-unit abutment level or implant level. And that's also another challenge with this is we have to get that patient out of their bar, so it's a bar overdenture, or get them out of their locators, and then we have to choose what multi-unit abutments are ideal. So we can help you out with that here at the lab, or you can choose them yourself and get those seated, and then again, multi-unit abutment level impressions. So this one's a little more complicated, but don't worry, we got you covered here in this book, and then ultimately we'll get you into a printed try-in and full arched fixed finals. So there's a ton of great workflows in this. Again, digital and analog, we got you covered no matter what the patient scenario is. You can download this from our website in an ebook version, or we can send you a physical version as well. Please give us a call with any questions here at the lab. Follow us on our socials. We have some great information on there on not just full arch, but everything in the lab world. And we look forward to working with you on your next full arch case. Thank you.